And now we are going to live to YouTube. So you guys should be able to start the meeting whenever you're ready.
Hey, good morning. It is 8:04. It is the November 26, 2024 Board of Health meeting minutes. The first item on our agenda is to call to order, so we will call the meeting to order. And now we have our roll call. So present we have Frank Ehrlich, Board of Health member, Joan McNeil, and then we also have Ken Lalim on the meeting. Ken, can you speak up just to verify you hear me okay? Okay. We also have staff members, Teresa Argandesi, Megan Fogno, Brian Weeks, and Aniela Fignon. And that's okay, great. The next item on the agenda is acceptance of minutes for the regular meeting, October 22nd, 2024. Do I have a motion to approve the minutes?
Yes.
We have Frank motion. Thank you. And a second?
I wasn't at that meeting.
Okay. Ken, are you able to second the motion for the minutes? Okay, 10 seconds. All those in favor, or any comments, edits, or suggestions? All right, all those in favor, say aye.
Aye.
All right, any abstentions? Any nays? All right, minutes pass. All right, the next item on the agenda is public participation. I see we have a hand raised. So Aniela, can you allow the member of the public to speak? I just want to remind you the limit for public participation is 3 minutes. It's related to an item on the agenda. And your time starts now. Good morning, Ms. Laricella.
Good morning. For the record, my name is Diane Lauricella. I've lived in Norwalk for over 40 years. I'm an environmental health consultant, and over the years, I have done some leadership related to public outreach through either when I was president of League of Women Voters, when I created and helped found the Norwalk River Watershed Association, former member, of course, etc. Sierra Club, Fairfield County Chair. The reason I'm mentioning this is because some of you do not know my background as far as how to get messages across when it relates to public health, environmental things, and the like. So the reason I wanted to speak today, I've passed several other months and just listened to your good work, is because we are, as you know, coming upon the infectious disease season of good tidings and bad tidings. I'd like this meeting to be my formal request, Deanna Diamore, of I'd like to meet with you and appropriate staff right after Thanksgiving so that we could put together a more holistic, creative, and wide-ranging infectious disease messaging where we talk to people about reducing their chance of getting infectious disease when they are amongst each other, including ventilation, which I've never heard of. I keep track of what I see on social media with the city. I get the Norwalk Hour. I do listen on occasion to Channel 12, and I just have been kind of sad that there hasn't been an effort to, and I blame partly, as you know, the federal CDC as well, but I really think we should do better, and we can do better. So I also wanted to challenge you and your great staff, if you could put something out in the social media or through the Common Council or the mayor's office about how to reduce getting COVID, RSV, and the flu during Thanksgiving. Let's seek more cooperation from the media. Let's have a true Thanksgiving, but not exchange too much in the way of infectious elements. Secondly, and I know when I'm done, some of you will say how much you're doing with the public. I'm sorry, I don't see it, and I talk to people. So let's do more. And then after Thanksgiving, let's meet and talk about it. You have a new Board of Health person coming on board that has quite a education background. So I'm looking forward to that person. I hope they get approved tonight at Common Council. Lastly, as far as Schedule 2025, I understand that 8 a.m. is very convenient for many of you. I would ask that you consider for your schedule to have at least a quarterly community updates in the evening and market it. Let people know that it's happening, and I'll help you. And let's make sure the Common Council does their job and tells their constituents that you're having an important quarterly community update or some kind of update in the evenings. Most people cannot come here at 8 a.m., as you know. I really appreciate and respect you all, but I am getting a sense that my good words and wise words that I have had ever since the pandemic have not rung true enough. Let's work together to improve what you all have done. Let's get the word out and reduce the spread. Thank you.
Thank you, Ms. Lauricella. Do we have anybody else from the public who wishes to speak? I'm not seeing anybody else. So we will close public participation.
Deanna, you're muted.
Thank you. I'm sorry. I was trying to do too much. Thank you. I don't see anyone else from the public, so we are going to close public participation. Next item on the agenda is our community health update. So I'm going to pass it on to Teresa Argandez, Assistant Director of Health for Community Health.
Good morning, everybody. Thanks, Deanna. So just a quick update on a couple things that we've had going on in community health. If I can get my computer to cooperate, that'd be awesome. Okay, great. I'm going to share some slides just to keep me from rambling too much. Have a new computer set up, and it's taken me a while to get used to. Let's see. Are you seeing my slides?
Yes.
Yes, great. Okay. Now can I get them to advance? Let's see. Here we go. Okay, so I just wanted to take a couple minutes to tell you about a couple things that have been going on in the community health division. First, I'll talk briefly about the Connecticut Public Health Association, which our annual meeting was just last week on Monday. I had to look at my calendar because it feels like it's been a little bit longer. We're also having some discussions with our local partners and state partners around Medicaid redesign that I wanted to update the board on. And then also just a quick update on Midpoint for a regional communications campaign that we've been participating in with several other local health departments in the area. So first, the Connecticut Public Health Association, as you may know, our state has a statewide public health association that includes academic partners, local health departments, and lots of other community-based organizations that do work in public health. And I'm thrilled to let folks know that the Community Health Division had two presentations this year. Omar and Megan had a presentation approved about the rapid community assessment, and Kelly and Julia presented on some of our community partnerships to prevent chronic disease. So just wanted to share a couple photos from the event. We were thrilled that everyone was able to hear about the great work that the health department's done. We got some great feedback and great questions from other individuals at the conference, and I personally was really excited to be there and learn from a lot of other presenters throughout the state. So the theme for this year's conference was building healthier communities together, centering community for change making. And so both of our presentations from the health department really highlighted our work to engage community members and community partners, both at the organizational level and at the individual level, to better understand the needs and adapt our programs and services to meet those needs. And so if we look at the photos from starting in the top left and go kind of, I guess, clockwise, this top left picture is a picture of Omar Rivera, our community health worker, presenting about the rapid community assessment, showing folks a couple of the places in Norwalk where we were out talking to community members and asking them specifically about childhood vaccination, any barriers they've had, where they find their information about vaccination, and other infectious disease topics. And then trying to better understand, what they would like to see the health department do more often. And so we were able to present results. We're still working on the Megan and Omar are working tirelessly on the final RCA report with great support from Brian in our epidemiology and informatics division. To try to pull all those results together, but we really did want to highlight all that outreach work that was done to collect that information, collect that data as we work to analyze it. Then we got a picture of the team. We had a good group that was able to attend CPHA. Kelly and Julia in this top right-hand corner presenting their presentation was entitled The Power of Partnerships, and they talked about a lot of the different chronic disease prevention programs and how we work with several community agencies to place these programs in the community, in places where people are and where people go to as trusted sources for information. And then, talking to our community partners about how we can do better and make improvements. And so down along the bottom row, we see Julia's presenting, Omar in front of his presentation, and Kelly presenting her portion. So I just wanted to give kudos to the team from Community Health and everybody from the health department for all their support in getting the word out there about all the great work that we do. So that was the Connecticut Public Health Association. Now we'll switch gears a little bit, talk about Medicaid. And so I just wanted to update folks about some discussions that we've been having with state partners, and then serving, in a very traditional public health role as a convener with our local partners to talk about some ideas on a local level. You may be familiar with the Health Enhancement Communities. It was an initiative, a pre-COVID initiative that the state launched to try to pull together multi-sector collaboratives to do community health improvement work, or who were doing community health improvement work, to learn from us about what it might look like if there was sustainable, flexible financing for some of the work that we do. Looking at, we all know in public health that's a tremendous amount of healthcare spending is spent on acute care after folks are getting sick. Sometimes it's doesn't have as much community involvement, in the healthcare sector as some of our community health improvement work. And so the State Office of Health Strategy was looking to find out how can we better support the work of community health improvement coalitions that bring in partners from healthcare, from public health, from education, from business, from all of these different sectors to do prevention work. And so we did a lot of great work a few years back with Office of Health Strategy to bring our coalition together. But then ironically enough, the funding from the state ended. And so our coalition had existed before this project and continues to operate as the Healthy for Life project now. But these health enhancement communities that were set up at the state level still exist in lots of different places throughout the state. So Public Act 23-171, which I'll admit I was not that familiar with until recently, is part of that Public Act, requires that the Department of Social Services develop a strategy to redesign Medicaid to really address health equity, improve community outcomes, and look at the delivery of the Medicaid system, and if there's any innovation that can be done to improve health outcomes for Husky patients throughout the state. Part of that work requires that DSS consult with hospitals, healthcare providers, and community organizations about what they think, how they think Medicaid, could be improved or innovated to meet some of those goals. So as a result of that, the Connecticut Hospital Association approached the health enhancement communities throughout the state with a proposal or a framework that they think would be an innovative way to update and redesign Medicaid. And so I won't go into the great details because it really is very conceptual at this point. A lot of the details still would have to be worked out, but they're looking to restructure the hospital taxation system in the state so that the hospitals pay additional taxes to then draw down federal matching dollars to help to fund some of these community health improvement projects, coalitions, and initiatives that are really community driven and are happening, you know, to prevent illness, and looking at some of the upstream social determinants of health, right? So using Medicaid dollars that are generated through hospital taxation to fund some of the work that we're doing to address social determinants. Again, very broad, conceptual. A lot of the details would still have to be worked out if DSS would decide to investigate this further. And so after the Hospital Association came to us with this framework and came to some of the health enhancement communities, we did what we normally do and pulled our partners together and said, you know, we want to hear from Norwalk folks what this might look like in Norwalk. Or does anyone have any concerns? You know, are there unintended consequences of a redesign like this that we might want to consider? And so we've had 2 local partner meetings so far, one in person at the hospital with some of our community-based organizations, and then one last week on Zoom to follow up and to process some of this information and to ask some more questions. And so we have a dialogue going back and forth with the Connecticut Hospital Association and a lot of our community partners to find out, you know, in theory, in these broad concepts of community driven, sustainable financing and funding for community health improvement work. Of course, we're definitely in great support of that. And so finding out more information about how this might look when it comes to Medicaid and you know, what the current Medicaid climate and environment, how that would look in Connecticut as a whole, and then specifically in Norwalk. To see if this is something that we want to create a letter of support or provide comments to DSS to ask them to investigate this further. And then, of course, if it's something that the Department of Social Services decides to move forward with or explore a little bit, we definitely want to be involved, learn about it as it's going, and provide input so that it really meets the needs of Norwalk residents and Husky patients throughout the state of Connecticut. So again, really big, high level, broad discussions with a lot of detail that would still have to be worked out. And of course, you know, it all depends on what the Department of Social Services and Dr. Barton Reeves wants to move forward with and investigate further. There's a couple other asks at the state level related to Medicaid, and by a couple, I mean a lot. And then there's also a couple other interesting, innovative models happening right now too. So we're just trying to keep abreast of everything and provide input wherever we can to make sure that that things move forward in a way that's equitable and provides the best opportunity for people in Norwalk to be healthy. And then just to change gears yet again, just a quick update. We're about the midpoint of a regional communications campaign that we entered into with several other local health departments in our area. I believe there's about I want to say about 7 or 8 towns that are currently involved in this campaign. Many local health departments received immunization funding to increase access to immunizations overall, and also raise awareness and provide information and central location for people to get accurate, reliable, science-based information about vaccination. And so many of health departments kind of move forward with their own activities, but some of us in our region said, hey, if we're going to do some big, large communications work, you know, the folks in Norwalk are going to also be spending time in Darien, are also going to be spending time in Westport, you know, et cetera, et cetera. Let's band together. Let's work on a campaign together so that everyone's getting a unified message. They're seeing similar materials out there in the community, and they have a central location that they can go to. So, so that's where we are right now. We've contracted with a communications firm that has put out information and a campaign called GetVaccinatedCT.org. Or Get Vaccinated CT, developed a centralized website at that URL that then links back to each individual health department. So if you're a Norwalk resident and you see a billboard or you see a bus ad or you hear a radio spot or a streaming spot on Spotify, or you're on social media and you see something there, you'll go to this central location, getvaccinatedct.org. And then if you want to learn more about your local health department and our vaccination services, there's a whole section where it highlights all the local health departments that are involved and links back to our website. So they're looking at 3 to 4 phases of this campaign. The first phase happened in the summer and it was all about back to school vaccinations. The second phase happened in the early fall, and that was around respiratory viruses. We're about to launch a third phase that's around holidays and staying healthy for the holidays. And then we're hoping to be able to get in a fourth phase in the spring with topics to be determined. We've talked a little bit about travel vaccinations and other spring related messaging that we can get out to folks. And so far the metrics that they've provided, I'm definitely not an expert in this area, but the communications metrics around how many people it's reaching, how many people are clicking to our website, how many people are responding positively to the advertisements is really good. Everything is looking really positive. We're getting great information from the communications firm. And so now we're in the process of, at the Norwalk level, pulling together data from surveys from our clients, additional feedback from our partners, as well as vaccination data, both at the local and state level, to see, you know, in the broad scheme, has this communications plan impacted people's actions and their attitudes around vaccination. So, like I said, the first phase launched in the summer, and we're hoping to run this all the way through spring. So we're right about at the midway point. I will definitely be able to come back to you all and provide a wrap up and some great information around click-through rates and cost per click and all that fun stuff around advertising once the campaign has wrapped up in this spring. But I just wanted to let you know that things are moving along really well, and we've been working really closely with other health departments in our area to bring unified messaging out to the whole region. Oh, and I actually did add in a couple of photos. So again, if we go top left and then go clockwise around, this top left-hand picture is a poster with a back to school list of things to do, and vaccinations is one of those things. And that's at the South Norwalk train station. On the top right, this is a screenshot from the homepage at getvaccinatedct.org. The bottom right is a billboard in Norwalk that we had placed for the fall season. And then this middle image here, Healthy Holidays, Happy Hearts, is a sneak peek of one of the social media posts that they've prepped for the holiday season for this phase of the campaign. And that's my update. So I'm happy to take any questions. I feel like the presentation was 3 very, very different topics, but I wanted to give you, we have a lot of long-term projects going on, a couple different areas. So I wanted to give you a little taste of everything, some of the things that we have.
Thank you so much, Teresa. I see Frank has his hand up.
Yeah, just a quick comment. Based on my experience in other states, and this is relative to the Public Health Association, the Medicaid proposal, not uncommonly, state hospital associations and state medical societies don't see eye to eye on issues. And I would just ask that someone involved with the Public Health Association make certain that there will not be resistance, because it sounds like the Hospital Association is taking a huge step forward, and I'd hate to see the Medical Society on the other side of the issue.
Thank you, Frank. That is really great feedback. You know, it's really interesting to discuss, you know, different aspects, especially of Medicaid, where public health, you know, we do bill for some services for Medicaid, but we're not as actively involved in Medicaid financing and Medicaid design. So hearing from our healthcare partners, and we're trying to be really mindful to make sure that that we're thinking through all the consequences of all the different, you know, potential things that are going on, and also to make sure that as many partners are involved in the discussion as possible, so that if there are implications that we're not thinking of, that, you know, that there are enough people around the table to, let's talk about, you know, what does this mean going down the road, and, you know, have as many perspectives in there as possible. And you're right, there has been some discussion about, you know, my side of the table has these motivations and your side of the table has this motivation. How can we work together to kind of make sure that those two things are complementing each other and not in opposition?
That's absolutely head on. Perfect.
Thank you, Frank.
This
Uh,
Ken, the other partner out there for all the sections of the state, community health centers have need to take a lead role in how that financing piece goes, because they've got their issues that are very real. And again, they're treating a third of the patients that we're talking about here, and they are very oriented towards community health and treating patients in the ambulatory environment. So there'd be another organization not to forget.
Absolutely, Ken. That was one of the first folks, some of the first phone calls I made when we first heard about this proposal, because that is a question that's come up even among partners who are non-healthcare providers, to say, would a proposal like this, would these concepts impact the reimbursement that primary care and that federally qualified health centers are currently receiving from Medicaid? Because we know that that is also an area that needs to have improvement, right? That reimbursement rates need to be better for Medicaid to ensure equal access to folks who are on Husky. And we've been assured that this is a separate, funding stream and a separate financing model, and it would not take money away from existing healthcare providers who are billing for Medicaid.
Yeah, they're actually trying to, the real key is in most states, it's under a managed care model and not under a straight fee for service model. There's a lot to be brought forward to make a change radical. I mean, the idea of this change that's being proposed, I think personally is great. It's coming up with funding on a regional basis. So you're getting away from this unit of use, piece, and there'd be a pooling of dollars that would be necessary to be drawn down on a regular basis. Idealistically, I think it's great that we're looking at things regionally. It's just really hard to get that many constituents at a table and everybody go, sure, I'm in.
Yeah.
But at some point in time, we'll be asked to either sign a letter or get involved in a committee or whatever it might be. And I do believe that the health department's got to be at the table, make that work.
Yeah.
Thank you, Ken. I think you hit on, that's probably a next step. So the Public Act that I mentioned states that the report from the Department of Social Services would need to be in by the end of this calendar year. And so I know the Connecticut Hospital Association was looking for some support and some comments before that time. I'm not sure that in Norwalk we'll get there. Well, we're doing our due diligence and we're having a lot of conversations and asking a lot of questions. But at some point we may, come to the board and to our other providers, our community partners, and say, is this something that we want to support with a specific letter that really especially supports some of these key concepts like like funding going to community-driven initiatives that are placed in the community that are requested specifically by the community that have evidence of improving health equity. And that there's transparency about how that funding, is allocated and distributed. Those kinds of broad concepts, I think we can all kind of unify behind. It's when we get into the more detailed discussion around Medicaid financing that I think we all want to get some more information and details, but I'll definitely keep you all posted and may be coming back at some point to request a letter of support or your support in our support.
Thank you so much, Teresa, and thank you for this great discussion. Anything else before we move on to the next item? All right, thank you. Next item on the agenda are epidemiology updates. So I'm going to pass it on to Brian Weeks, our Program Director of Epidemiology and Informatics.
Hey, good morning, everybody. Thank you, Deanna. So I'll just do kind of the stereotypical kind of update. We're going to talk about respiratory viruses, then we're going to just talk about Mpox really quick, and then switch over to just about air quality, and that's it. So with that said, I'm going to pull up my screen share. So what you guys should be seeing on your screen right now is the CDC Respiratory Illness Data Channel, the quick loadout, basically to give a snapshot of what's going on in the community. And so if we scroll down to kind of see the full picture, you can see that, they kind of look at, the three metrics, that's the overall situation, wastewater viral activity levels, and the emergency department visits. And we're looking at the country right now. So right now, overall respiratory illness activity for the country is at low. We follow that with the wastewater monitoring. COVID-19 and flu is at low, RSV at minimal, emergency department visits in the United States, COVID is at minimal with decreasing trends. But then it's low and increasing trends for flu and RSV. And so what you'll also see, which is kind of interesting for Connecticut, we're actually experiencing moderate overall respiratory illness activity. So low for COVID-19, wastewater viral activity levels, flu at minimal, RSV at low, emergency department visits in Connecticut for COVID-19, low with no change, flu minimal with no change, and then RSV low but increasing trends. And so if we look in and zoom on this data a little bit in greater detail, you can start looking at these different kind of visualizations the CDC has developed, which again, I think they've done a really great job. They kind of put everything together, especially what we've learned over the different years dealing with, especially COVID-19 and other respiratory viruses. So, first one here is kind of essentially what was the syndromic surveillance or symptomatic kind of surveillance relative to respiratory viruses. So this is including the whole gamut of fever, but also can include other symptoms that present relative to any respiratory viruses. So it gives us a much better idea of people presenting with illness in the realm of respiratory illness. And so what you see is it relative to each state. And what's interesting here is, that moderate activity that we were seeing before for like Connecticut, as you can see, we're in the orange here. But then also just parts of kind of like the East Coast as well as like the Midwest. So you can kind of see like almost like the northeastern part of the country, kind of in that mix. And so with that kind of moderate acute respiratory illness activity, but then also you can see just a majority of the country at least experiencing that low activity, and then only like the West Coast experiencing minimal activity. And then looking at the wastewater map by state, this is looking at it for COVID-19. You can see how COVID's just still kind of spread around throughout the country, at each state kind of experiencing the different kind of level of activity. Especially, you can see how the Southwest experiencing a little bit more compared to the other states, but you can see how the Northeast is kind of in that low to moderate activity. And then look at it for influenza A, you can see how like, especially the Southwest and the West Coast experiencing the kind of the highest activity, but also a good concentration going on in the southeastern part of the country as well, in the mid-Atlantic states. And then also even Massachusetts and Rhode Island here in low and moderate activity for the Northeast. And then RSV is the one to really keep an eye on right now. But you can see how, especially like the South and the Southeast too, is also picking up relative to RSV, and including, especially Rhode Island here, but Massachusetts and Connecticut having that kind of low activity. And so we'll also see that relative to emergency department visits. And so now this is looking at it for the nation again. You can see how that RSV and flu trends are increasing, and then COVID is slowly decreasing. And then, along with that, now zooming into Connecticut, you can see again, COVID having that kind of gradual decrease, but then RSV and flu having their gradual increase. And so it's just something to be mindful of as, especially, we are heading in towards the, Thanksgiving season very soon here with this week. And so usually it's the big catalyst as we're very familiar with. And so there's another great thing I mentioned in our last meeting. I just want to reemphasize because I think this is a great way just to forecast kind of where things are going when the CDC especially factors in, especially the emergency department data. This is for COVID-19. What we don't want to see is the magenta-like colors, so that, pinkish, and dark pinkish purple. And then, what we do want to see is like the green and the dark green, right? And that's indicating a decreasing trend, right? And so when you look at it for COVID-19 with this kind of data and this kind of forecasting, you can see how, like, especially New York State's definitely got a growing trend relative to COVID-19. But for the rest of the Northeast, generally speaking, we are experiencing a downtrend or decrease, as we kind of saw further confirmed with the other data sets, including Connecticut and then also parts of the Southeast. But you can see how parts of the South and the Southwest and some of the Midwest too, along with obviously New York, kind of showing that uptick. And then, for influenza, pretty much the story holds pretty consistently throughout the country, aside from those that maybe are not experiencing any change at the moment relative to this forecasting. But definitely the West, the Southwest, the South, a good portion of the Midwest, and including the Northeast is experiencing a likely growing status for influenza. They currently don't have this for RSV, but you can actually probably anticipate something more or less similar relative to each state with that kind of data being factored in, because RSV is also experiencing that uptick. And that's further confirmed with the percent of positive tests for respiratory viruses. Again, looking at the big three, you can see right now, nationally speaking, COVID-19 is on a decrease, which is good. That means we have also adequate testing going on in nationally speaking. But you can see how RSV here in the purple is the highest and definitely indicating a steep uptrend, as well as kind of a moderate uptrend relative to flu. So what it again suggests is when physicians and medical offices are testing their patients, definitely there's some more room for testing to address, RSV and flu. And so again, it should be higher suspicion too, as, kind of seeing these steep curves, especially for RSV. So definitely more testing should be occurring relative to that, or suspicion of illness too. And so just want to kind of give you guys an update relative to that. Again, just breezing through, we're all familiar with this, just as a reminder, because the Thanksgiving holiday is coming up, and that's a big kind of kickstart to the season, an uptick to the season. Again, you got the immunizations as part of the core prevention strategies, as kind of also alluded to earlier with Teresa's presentation. Then also with, just the hand hygiene and respiratory etiquette, steps for cleaner air, including, different types of ventilation and air purification, treatment for those that are eligible, and staying home, preventing spread. That's one of the biggest things, and not exposing others, especially at work and other extracurriculars and social events. And then along with that, the additional prevention strategies, using masks, social distancing and distancing in general, and then also testing just to verify if somebody's still actively shedding the virus, especially at levels that can definitely be much more transmissible. And then also, as everybody's familiar with at this point, the covidtest.gov. But if not, and you haven't done your order yet, this is definitely something you get for the holidays too. Definitely have that in supply and in stock just for testing yourself or somebody else in your household. Especially if you're going to social events or large gatherings, testing beforehand too, if you have any suspicion of after having been exposed to any sort of respiratory virus, or if you're suspecting you're actually starting to present with one. And so then along with that, switching gears now, just want to talk about Mpox really quick. So the United States had its first case of Clade 1 Mpox diagnosed. That was in California. It's about 2 weeks ago that this occurred. The big thing again about Clade 1 is it's more infectious and potentially more fatal in comparison to Clade 2, which is what we've been dealing with since 2022 with the number of outbreaks that have been occurring globally speaking. Clade 1 has also been popping up in other countries as well, here and there. Fortunately for this situation, this was travel related to endemic areas in Africa regardless. It is suggestive that, we still have to keep our guard up. Risk to the public in the United States is low, but we want to be mindful of this. And anybody that's presenting with any symptoms, remotely close to Mpox or have done any travel relative to those areas, endemic areas in Africa, that's the prior CDC Health Alert Network message. Making sure that they follow the medical provider right away. get tested, and also take the proper precautions, and also notify the appropriate partners, things of that nature. So we just want to remind everybody about that, because this is, again, something that causes our hairs to stick up on the back of our neck, so to speak, as we kind of monitor the situation. Keep in mind, relative to clade 2 mpox, we saw it kind of uptick around April of this year. And so we should kind of anticipate something potentially similar relative to clade 2 again. But then also at the same time, clade 1 may also have some of that presentation too, if there's any potential for community-related transmission. At the moment, there's no evidence of that, but we should be prepared for this and mitigating this as much as possible, again, by actively seeking or those that suspect that they may have it, seeking medical care, and also providing that testing and keeping an eye out for it. And then switching gears once more, just as kind of, if we're familiar with, everybody keeps, or not everybody, but we may have smelled kind of what's smelled like a giant barbecue going on in your backyard. But regardless, we have had air quality issues as of late related to various wildfires, brush fires that have been occurring, more or less in Massachusetts, but also just in other parts of the state and country, where obviously the wind is going to blow it in our direction. So it does impact air quality. And so just as a reminder, norwalkct.gov/air, the Norwalk Air Quality Monitor Hub is still active, and you can definitely go to it for active kind of air quality index indicators for the area, as well as the forecast, how to understand the air quality index, as well as the forecasting too, and then looking at it from the national level. This is just kind of a compilation of all the resources out there, just to make it a one-stop shop for everybody to understand and kind of know what's going on. So always feel free to drop by. Again, norwalkct.gov/air. Also just looking at the wind currents and how that's played into it. So again, Hearst Media has a really great visual relative to that. How you can get active information too, as well as from the Air Now app that you can download to your phone. The connection in terms of air quality and health, as well as what one can do to protect themselves, and then also signing up for the appropriate emergency and city notifications, as well as even the Air Now air quality notifications, so they can stay in the loop, and then keep an eye and tabs on everything else related to public health too. So just, again, it's a nice one-stop shop for everything, so we can kind of see what's going on, because obviously this is related to the drought conditions as well that we've been experiencing in the state, and so just being mindful of this, and as we kind of keep making our way through the season. So in summation, or in summary, the respiratory virus situation, fortunately is lower relative to COVID, but we are seeing that uptick for flu and RSV, especially here in Connecticut. So we want to be ready for that as the season kind of progresses, following the prevention measures just as outlined. Be very alert, especially medical providers, as well as those that have traveled to areas endemic with mpox in Africa, or any suspicion of having had close contact, with anybody that is, potentially presenting with mpox or has been determined to have mpox. That's clade 2, but also now, especially, we just got to be very mindful of clade 1, knowing that we just had our first detection here in the United States. Fortunately, not community related, but still very important. And then also just the air quality, and you can kind of monitor the situation as things kind of vary relative to that circumstances. But fortunately, we have something very specific to Norwalk. Again, norwalkct.gov/air. And so that is my overview. Thanks, everybody. Have a great holiday.
Thank you so much, Brian. Does anybody have any questions or comments related to Brian's update?
No, I'm good.
In my opinion on it, it's a little bit too short. I find he has an enormous amount of information that we get 15 minutes a month. I'm wondering if it's worthwhile having some special session on what he can produce, whether it's citywide, board-wise, whatever. I think there's an awful lot of information there that could be very useful to community.
I love that idea, Ken.
I also had a quick question, and if it's too basic for everyone, I apologize. When I look at the nationwide data and I see Connecticut with worse data than surrounding states, makes me wonder, because I know Brian is asking why, but I wonder if anyone else and who else in Connecticut is really asking the why. Looking at the data and knowing we're in worse shape or better shape is wonderful, but someone has to ask why. Why are we doing better? Why are we doing worse? And it shouldn't be just Brian in Norwalk.
Mm.
Thank you, Frank. Brian, I don't know if you have any anything to comment on that. But I know, like, we have periodic updates from the state health department where we discuss a lot of these issues as well. So Brian does it. I'm totally biased, but I think Brian's the best epidemiologist in the state of Connecticut. But I know there are some great other public health professionals too that are asking some of those questions, at least at the state health department level. But I think it's about elevating it into larger community conversations, right? Making sure,
Yes.
it's not just happening between board members and public, it's happening in the broader community as well. And I think also, this is the side with public health, we have to figure out a way to tell our stories and tell the importance of public health and the work and the investigation of the why and the different prevention measures and, what we all could be doing, to protect, each other and the community. Anything else? All right, thank you, Brian. All right, last item, well, not last item, second to last item, the director's report. So Brian, you spoke about, air quality. Also, want to further highlight some of the drought issues that we've been seeing. So recently the mayor had issued a drought advisory after we worked with the Office of Emergency Management, the mayor's office, and the water utility companies, and looking at, the different levels. And really, the drought is a state issue, as we know. And so we just wanted to make sure everyone in Norwalk knew that, we were also impacted by it. Fortunately, we received rain last week, about 2.5 inches of rain, and we have a follow-up meeting with the water utility companies this morning just to see, where are we now? Did that have any measurable impact on the water levels? So, and the drought conditions. So we'll continue to have those conversations and monitor the situation ongoing so that we can, continue to push out any relevant messages related to conservation messages and the drought and the like. So just want to let you know that we're all the health department is part of those efforts and those conversations. We do have a new board member, as Ms. Laura Cella mentioned in her comments, that is on the agenda for the Common Council this evening, Anthony Santella. We have fortune of knowing him and having partnered him on some, linkages between public health practice and academic and talking about the work of public health professionals and linking to students. And so we're excited that he's on the agenda, and we're hoping that the Common Council will, approve his appointment this evening. But we may soon have our 6th board member again after the Common Council meets this evening. And then lastly, I just want to say we're in budget season, working on our budget proposals. I'm going through that review. And so wanted to let you all know that I did put in a request for some of that additional staffing that I had put in last year, for a grant-funded public health nurse to be city funded, and from a part-time environmental health professional to be full-time. As you know, the mandates at the state have gotten greater related to lead poisoning prevention and control, related to investigating cases of children with elevated blood lead levels. So our activities for that are increasing significantly and going to change even more come January 1. And oftentimes we have, our local mandates from ordinances, several times we've had, asks from the community and from elected officials for the health department to do more related to enforcement. And so as we have these mandates, we want to be able to be sure that we keep up to these health and safety standards. So I did put that request in, and did put, at the same time as some, the asks are getting greater, the mandates are getting greater. We also are facing potential loss of grant funding. We've been able to carry funding. We've been able to get additional funding through the pandemic. But some of those grants are going to be ending. So we want to be able to maintain the services that are needed within the community and that the community has come to expect from us. As the community has been evolving and changing, we've really grown to accommodate those needs and to meet the needs. So wanted to let you know that, and I'll keep you updated as we go through the budget season. All right. So then next is their discussion about Board of Health meeting dates. So I had circulated some potential meeting dates to follow what we've been doing this previous year based on comments about meeting times. So typically the fourth Tuesday of the month at 8 a.m. There are a couple that conflict with holidays. They're really close to a holiday. Like there's the 4th September is Rosh Hashanah, the 4th Tuesday in December, I think it's Christmas Eve. So there's potentially some changing those days, but I wanted to know if anyone had any thoughts about that schedule or our meetings for calendar year 2025.
I am fine with those days.
Thanks, Joan.
I'm fine with those dates.
Thanks, Frank.
Those dates.
Okay. Thank you, Ken. I heard back from Janet and Norman as well. Okay, and then we can talk too. I know we've been talking in the past about, in fact, we've had some evening meetings. We've switched back and forth, and we didn't see, when we switched, we didn't see great participation or any big difference between the evenings, but we can talk about, do we want to have not just our, standard meeting, but like maybe an event, where we highlight some efforts, or we drive, do community sessions, community events. I know, Ken, you mentioned, maybe finding time where Brian can go into more detail and talk about more about, the epidemiology updates. So we can explore that too, and always put those on the calendar throughout the year. All right.
I always found in previous jobs that I had that if you load us all board members with certain facts this time of year, the number of cocktail parties and holiday events and all the rest, you get a chance to, when somebody says, "Oh, what do you do?" and you come up with the health of the community. It's a great conversation piece that isn't necessarily political yet, which would be nice.
Thanks, Ken. All right. Any other discussion items before we adjourn?
No.
All right. Hearing none, it is 8:56. I hope everyone has a lovely Thanksgiving and has a great rest of their week and their day. Thank you, everyone.
you
Adjourn
too.
8:56.
Thank you.
Thanks, everybody.
Thank you.